Hello and welcome to Unmasking the Truth, the podcast where we're going to be talking about masks in the COVID-19 pandemic. We're going to have 3 student panelists on this podcast. First, I'll introduce myself. My name is Phoebe.
My name is Nikki.
And my name is Rayhan.
Our guest today is Dr. Khuc, who is a gastroenterology fellow working in Baltimore, Maryland. Would you mind telling us a little bit about what you do and your specialty?
Hi, yes. Nice to meet everyone. Thank you for having me here and for letting me share my experiences working in the different hospitals during the COVID-19 pandemic. I'm a gastroenterology fellow, like Nikki said, at the University of Maryland Medical Center up in Baltimore, Maryland.
And so today we'll just be discussing how face masks have been utilized as a means of combating the transmission of COVID-19, as well as the effectiveness of this intervention. So before we discuss this intervention, we'd like to provide a brief background of COVID-19 and how it spreads. So COVID-19, in case you don't know, is a respiratory illness that spreads through contact with respiratory droplets. These droplets are produced when infected people cough, sneeze, talk, or even interact in any sort of way. And infectious patients may display few or even no symptoms at all, and they may not even realize that they're infected. So as a result of this, along with the virus being airborne as well, current methods of prevention include social distancing, increased hygiene and the use of sanitizers, frequent testing, quarantining when exhibiting symptoms, and masks, which leads to our main case study, which involves the intervention of face masks. And face masks, they have been commonplace for almost 7 centuries now, as it dates back to the 14th century that they have been used as a method of protection from respiratory pandemics. And they're also now available in over 100 countries. And even the United States has their own mask mandates as well. So we'll have Phoebe introduce the pros of face masks.
Thank you. For the pros of face masks, there have been multiple studies included in this case study, which they looked at that demonstrated the effectiveness of face masks in decreasing the transmission of COVID-19. First, the study was conducted in the reduction of transmission of COVID-19 in Beijing households, which demonstrated that face masks were 79% effective in preventing transmission if used by all household members prior to symptoms occurring. Another systematic review was conducted by the WHO on the transmission of COVID-19 that demonstrated that people who always wear face masks when going out had a risk reduction of 70%. There was also studies that showed that homemade face masks were proven effective, not just surgical or medical face masks. A laboratory study conducted by the Usher Institute demonstrated that homemade face masks worn by sick people can reduce virus transmission by mitigating aerosol dispersal, and homemade face masks worn by sick people can also reduce transmission through droplets. And when making the face masks, cotton, polyester, when put in multiple layers, have been proven especially effective and sometimes even more effective than the medical face masks themselves. And then when there were studies conducted looking at the different regions without universal face masks, transmissions were 7.5 times higher in countries that did not have face mask mandates. And compared to places without face mask mandates, the daily growth rate was 2.0 percentage points lower in states with mask mandates. So overall, since May 22nd, 2020, mask mandates have prevented 230,000 to 450,000 COVID-19 cases. And even if face mask effectiveness was at 50%, if all individuals were required to wear masks at all times, the effective reproduction number would be below the threshold. And if 80% to 90% of people wear face masks, the COVID-19 virus could eventually be eliminated. Next, we have Nikki discussing the potential cons of face masks.
Well, even though face masks have been proven to be very effective, there are still a few downfalls, and some would say that there's not enough evidence, because while there is a lot of direct evidence supporting the efficacy of mask use, there's not enough studies that have been conducted to prove the effectiveness of face masks as conclusive. Another downfall of face mask usage is that it varies by region and it could severely alter the outcomes. And different countries, states, and counties change their regulations, and they all vary. And there's also different beliefs by the people wearing the face mask that may affect how they follow these regulations. And there's also ethical and moral implications, and some would say that masks interfere with day-to-day life and There are also people with disabilities, such as deaf people who have trouble reading lips when people wear masks. So there's a little bit of conflict in that area. And there are also people who have different medical conditions that could interfere with their mask wearing. And some would say that they can't wear a mask because they have a health issue, but in some cases it's not really applicable, even when they say it is. And there's also different legal implications, where some people would argue that it's a person's right to freedom and freedom of choice to wear a face mask. And there's also a global shortage of protective equipment such as face masks and other PPE that are needed for healthcare workers and people around the world.
Alright, so these are some excellent points you brought up, and given all the information that we've been provided, I figured it would be a good idea to just have a discussion on all the factors at play. So one question that I thought would be relevant is, who should be required to wear masks? Like, would it be like any age, or would it discriminate between like young children versus adults or the elderly? Like, I want to hear what your guys' opinions are on those.
I think that everyone should wear masks regardless of their age, because it has been shown to affect more of the older population, like more severely, but younger people still get infected, and they're the main ones spreading the virus around.
Definitely.
Yeah, I agree with Nikki in the sense that in a perfect world, everyone would wear a face mask, no matter the age, even young children. I know with the first strain of COVID-19, it didn't really affect young children too much, but now with the different mutations, now young children could face the huge consequences of COVID. And I know that there's been a lot of controversy regarding like 2-year-olds who do or don't wear a face mask on airplanes and what that leads to. So I understand that really young children, like toddlers, they might not quite understand what it means to wear a face mask. But just going to grocery stores and seeing like the small little toddlers run around, and they still understand the implications of staying safe, so still putting things in their mouth, and it just scares me that they could potentially then spread it to their family just because they're too young to understand what's going on.
Yeah, for sure. So there are also cases where people are asymptomatic as well. And so, like, even though, you feel totally fine, like, the odds are, like, you could still be carrying it, too. And then, even though you might be fine, you might end up transmitting it to somebody else that, like, they might be immunocompromised or older in age or whatever you may have. Like, they would be at a much higher risk of, like, getting more deadly symptoms. So, like, it's definitely just to be mindful of others, even if you yourself don't really care about contracting it, like, just to have enough courtesy to like make sure you're not spreading it to others.
COVID-19 is a virus. It's transmitted through the air, aerosolized, and it basically is transmitted through the mucosal surfaces of your face. Your eyes, your nose, and your mouth all have mucosal surfaces for COVID-19 to be transmitted to. So by wearing a mask, you're protecting your nose and your mouth, and then by wearing eye gear, for us in the hospital, we always wear eye gear. You're protecting your eyes from getting COVID-19. And I think there's confusion in that people think when they wear masks that it's protecting them from getting COVID-19. But really, when you're wearing a mask, it's more so that you are protecting others from getting COVID-19 from you. Many people, especially the young population in their 20s and 30s, they may have COVID-19 but be completely asymptomatic.
Our next question is, like, now that all the vaccines are rolling in as well, how would that affect how like masks are being used in the community?
Wearing masks, washing your hands, keeping socially distant 6 feet away, that's imperative to keeping COVID-19 at bay. The vaccines are not the answer to getting rid of COVID-19. They're preventing many of us from getting COVID-19, but the answer really is in the mask wearing, the social distancing, the hand washing, the hand sanitizing.
Well, I think in the case of vaccines, I don't think they're necessarily the direct answer to COVID-19. We know from data that masks are the most effective way of preventing COVID from being spread around. Therefore, hopefully over time, when COVID cases become lower, that mask mandates can end. But I don't think that medical officials should base when the mask mandates are released. They should base it off the transmission rates, depending on how many COVID cases we're having daily. I think it would be pretty premature if we think half of the population's vaccinated, we should release mask mandates. There's still the potential of even getting COVID with the vaccine. I've had some friends who've gotten the vaccine and still acquired COVID. So we know that masks are the most effective way of preventing the spread. So it's going to be very important to make sure that the mask mandates aren't prematurely ended.
Like Thi Thi said, I also think that the mask mandate shouldn't be ended too early, because even with the vaccine, you can still get infected, but it just helps your body fight it off easier. And like this kind of relates to our own college campus, because I know now that they're requiring most people to get vaccinated with a few exceptions. I think they'll still have all of the students wear masks around campus and like in buildings just to protect each other from other ongoing illnesses and possible different strains of the virus as well.
Yeah, definitely. Like, I feel like although the vaccines have been rolling out, like masks are still like here to stay, at least for the like foreseeable future. Like, of course, eventually you want to return back to normalcy and like eventually have people not wearing masks at all. But right now, I just feel like you guys said, like it would be premature to do away with masks entirely. And like Phoebe also brought up a good point about how they should make that decision based off of like the number of cases and like the transmission rates rather than the number of people being vaccinated, because you can still have like a lot of cases going around even with the like significant amount of vaccinations out. Like people can still contract the virus being vaccinated. So like just having both working at the same time, it would speed up the process a lot, and then we can work towards eliminating masks entirely in the future.
Yeah, adding on to that, we're discussing how COVID is mutating constantly. And while the first strand is being fought with the vaccine, there's now new strains of the virus that aren't effective with the current COVID vaccine. Therefore, I think that masks are the only solution in a sense. If everyone's effective and wearing masks, even as we mentioned earlier, 80 to 90%, the COVID-19 virus could be suppressed and eliminated.
And yeah, like, even like I have my own personal anecdote as well. Like my grandparents, they were moving, I want to say back around in February. So back then, like only healthcare professionals and maybe like a couple other exceptions for groups were like able to get vaccinated. I think it was the older generations. But yeah, so I was helping her move, and it was me, my grandparents, and my mom, and my uncle was also with us, and we were all wearing our masks. But like the next day, my uncle, he started feeling like a fever and he was getting sick, and then it turns out that he actually had COVID like the day that he was helping us move. And luckily, like all of us had our masks on, even though we weren't like fully vaccinated or anything, and like we were luckily like able to avoid contracting. It's like it's just crazy to think like had we not been wearing our masks, like a lot of us probably would have ended up catching it. And like my grandparents, they're like getting up there in age, 60s, 70s, like they're definitely at a higher risk. So it's just crazy to see like that's really like how masks in action, like how successful they are. So that's just like a little personal anecdote
regarding masks. Is what is the protocol for PPE in the hospital you currently work at, and also any past hospitals that you have experience with during this pandemic? Has it become more strict or lenient in the past months?
Okay. So to answer that question, I guess I can give two perspectives. I just started my training here in gastroenterology June of 2020, in the middle of the pandemic. Prior to that, I was doing my internal medicine residency training program at Loma Linda University out in California, in Southern California. And that was during the start of the pandemic. So my experiences at both hospitals have been very different in the fact that when I was at Loma Linda, the pandemic had just started. And like many other hospitals across the nation, there was not a lot known about COVID-19. Scientists and the CDC were still trying to figure out how it was being transmitted to patients or from person to person. So when we first started back in March 2020, there was a lot of emphasis placed on just assuming that it was aerosolized and that we should prepare with our PPE to the most, how would I say, like the most secure way we could. Don't leave any opportunity for the virus to infect you or any other people.
But leading off of like the large amount or the increased amount of protocol that you have to go through, would you say that treating patients with COVID and just treating other patients with general long-term illnesses or just regular injuries have grown easier or more difficult? And like, how has it progressed from the beginning of the pandemic to now?
Okay, I would say the protocol is a hassle because it's very time consuming, but it's needed to keep our patients safe. It takes more time in a day to see one patient and treat them and speak to them. And a lot of times it's very hard to communicate with patients because we have 2 masks on. They can't hear us very well. So I would say with the protocol, things have been more inefficient in terms of seeing patients and the time spent trying to figure out how to diagnose them and manage them. But it's what's needed to keep the patient safe and prevent those who don't have COVID from getting COVID.
So I'd like to thank our esteemed guests and panelists for joining us on this discussion today. I feel as though this was quite beneficial and we were all able to take away a lot of messages from this discussion. So just to recap, we discussed like the intervention of face masks, and we also talked about COVID-19 itself and how it's been transmitted, how people have been dealing with it, as well as like looking towards the future as well. We also discussed, with relation to face masks specifically, the pros and cons that they present, as well as just like even some of our own experiences with face masks as well.
Thank you, Dr. Khuc, for participating in this podcast. Are there any final words you would like to share?
Everyone can save lives. You don't have to be a nurse, a respiratory therapist, a physician to save lives when it comes to COVID-19. If anything, it's the whole population as a whole that can save lives by preventing it from being transmitted from person to person.
So all in all, this experience proved to be quite beneficial, and I'd like to thank you all once again